So, you're gearing up for the Next Generation NCLEX, and I bet the pressure is on. I mean, this isn't just another test, right? It's pretty much the final hurdle. But here's the plan. In the next few minutes, we're going to break this whole thing down and give you a real, concrete plan to turn all that anxiety into straight-up confidence. Let's dive in. I'm guessing this question is running through your head pretty much 24/7. It's the big one, no doubt about it. And yeah, it's been redesigned to be more challenging. But you have to remember, every single thing you've learned has been leading up to this. You're so much closer than you think. And that, right there, is the absolute key. The NCLEX isn't trying to trick you with obscure facts. It's built to see how you think, how you take what you know and apply it in the real world to make safe, smart decisions for your patients. It's testing the #1 skill you've been building this whole time.
Okay, so let's just meet this challenge head on. No sugarcoating it. It's new, it's different, and you know what? It is completely normal to feel a little bit intimidated by it all.
Yeah, the anxiety is real. You're looking at question formats you've maybe never seen. These case studies that change right on the screen, and the stakes feel incredibly high. We totally get what you're up against, and that's exactly why we're going to get you the clarity you need to walk in there and own it.
So, the very first step to conquering this thing, you gotta know what you're up against. Let's pull back the curtain and decode the exact question formats you are going to see. No more surprises. First up, the one everybody loves to hate, select all that apply, or SATA. Now, the good news is the NGN version uses partial credit, which is awesome. But the challenge is the same. You have to look at every single option and decide if it stands on its own. And this, right here, is the golden rule for SATA questions. Seriously, don't look at it as one giant scary question. Take it piece by piece. Is option A true or false for this patient? What about B, C? This one little mental trick stops you from getting all tangled up and doubting yourself.
Next up, ordered response. This one is all about prioritization, which, let's be honest, is what you'll be doing every minute of every shift as a nurse. They give you a bunch of actions, and you've got to drag them into the right order.
And here's the pro tip. Your anchor for these questions is always patient safety. Before you even think about the second or third step, just ask yourself, what is the one thing on this list that I absolutely have to do first to keep my patients safe? Get that first one right, and the rest usually just clicks into place.
All right, fill in the blank. There's no multiple choice safety net here. This is pure precision. This is where all that time you spent on dosage calculations and I's and O's really pays off. And trust me, you're going to want to double check your math on these.
Then you've got the hotspot. It's pretty cool, actually. You'll get an image, could be anything, an EKG strip, a picture of an abdomen, an injection site, and you just have to click on the specific area they're asking about. It's a direct test of your visual assessment skills.
Drag and drop questions are all about making connections. They're basically asking, can you link this medication to its most common side effect, or this symptom to the right disease? It's about seeing how all the pieces of the clinical puzzle fit together.
And now for the main event. The biggest change to the NCLEX, by far, the unfolding case study. This is where the exam really mimics real life. You'll get 6 questions all tied to one patient. You start with their initial story, but then bam, new lab results pop up. Their vital signs change. Their condition evolves right in front of you, just like a real ship. And right in the middle of that case study, you'll often find this thing called the bow tie item. It looks intimidating, but it's actually pretty brilliant. You have to connect all the dots. In the middle, you pinpoint the problem. What's most likely going on? On the left, you pick the actions you're going to take right now. And on the right, you decide what you need to watch to see if they're getting better or worse. It's the entire nursing process in one single item.
So now you know exactly what the questions look like. But as this person who passed wisely said, that's really only half the battle. Now we got to talk about the other half, how you actually practice for this stuff.
Okay, let's talk strategy. A solid practice plan is what turns wishful thinking into real confidence. It's time to build yours. Here it is, the 4 pillars of a plan that works. You start with timed sets by category, like all cardiac or all peds, to get fast and accurate. Then you have to do full CAT simulations to build your mental stamina. And this is crucial. After every practice session, you do a deep dive into the rationales. That tells you exactly what weak spots you need to go back and study.
Remember this number, 135. That's the maximum number of questions you might have to answer. Now, the test is adaptive, so it could shut off way earlier, but you have to train for the marathon. Doing those full simulations trains your brain to stay sharp even when you're getting tired. Endurance is everything.
Okay,
Lean in, because if you only take one piece of advice from this whole thing, let it be this. Reviewing the rationales is the single most important thing you can do. You have to understand why the right answer is right, and just as important, why all the wrong answers are wrong. That is how you learn to think the way the NCLEX wants you to think.
So there you have it. You know the question types, and you've got a blueprint for how to practice. This is your path. This is how you go from feeling totally overwhelmed to feeling completely ready.
And please remember this. Nobody expects you to know everything. It's impossible. The exam knows that. Your goal is just to prove that you can use the knowledge you have to make safe, sound clinical judgments. You're not aiming for perfection. You're aiming to be a safe, competent nurse.
So I'll leave you with this thought. This whole thing, it's not just about passing an exam. Every practice question you grind through, every rationale you read, it's all preparing you for a real person who is going to need you. Your first patient is out there. Your preparation starts today. You can do this.